I'm Dr. Neel Shah, and welcome to the DBT Podcast. Welcome to the DBT Podcast. I'm your host, Dr. Neel Shah. Today, we're going to be talking to a foremost expert in the country on stroke and how to understand it, prevent it, and attack it if it occurs to you. And I have I'm so lucky to have a world expert in strokes, Dr. Dhruvil Pandya. Welcome from Northwestern. How you doing today?
I'm doing great, man. Thanks for inviting me.
Man, you look younger and younger every time I see you.
My secret is taking care of yourself.
Dr. Pandya not only is a stroke expert, but he does a lot of lifestyle prevention things. We're going to talk about stress and some other things, but maybe we can just start off by talking about strokes in general. Everyone's heard of a stroke. Maybe we can start talking about, what are the signs and symptoms of a stroke, and when was this first discovered? When did we discover that people could have this type of thing?
Yeah, I think this is a really good question for a general population, right? Because stroke is a deadly condition, right? Number 4 in a cause of mortality in USA, number 2 in the world.
Okay.
But most importantly, it's the number 1 cause of disability, right? Things that matters to us all, right? A quality of life, us talking, eating, walking. So when we think about stroke, prevention is probably the best way to treat a stroke. And what I mean by that is primary preventions.
Yeah, I think we are now getting to this age of longevity and making sure we don't wait till we have a stroke. We do what we can to just never get it, or at the very least reduce our risk to give us the lowest chance of getting it. And that's the way I think about cancer too. What can I do to completely reduce my risk? Things happen to people. People still get strokes, even if they do everything. But I think there's a way to reduce risk, as you're saying, primary prevention. And I think another thing you really brought up was, and this is what I think about for myself and my patients, is how can I continue to live where I'm at versus reacting to something in the future? So how do you prevent a stroke? Like, how can you, luckily, like all 4 of my parents, none of them have had strokes or heart attacks so far. I'm just wondering, like, what are the things that you think people can do to, decrease their risk? We've already had a cardiologist on. I've interviewed a cancer specialist to reduce their risk of cancer. We've talked about those things on the podcast. What about stroke?
So whenever I think about a stroke, right, I think about it in stages. So first stage is, as you mentioned, primary prevention, right? Which basically starts on a day-to-day basis. What do you do every day in your life? Whether it's what you eating, what you exercising, managing stress, adequate sleep, controlling your cardiovascular risk factors, right? So things like controlling your blood pressure, diabetes, cholesterol, weight, alcohol, smoking. All these are what we call modified risk factors which impact stroke. So this starts actually, when you are probably in your young days and the lifestyle that you live, which ultimately results into a lot of these cardiovascular risk factors, right? So when you think about preventing, you really have to kind of, number 1, go to your doctor on a yearly basis, get your checkups, right? Get your blood work done, get your blood pressure checked. Number 2, eating well, right? I think the best data that we have on eating well is a Mediterranean diet. Number 3, physical activity, right? At least 30 minutes of a day of moderate exercise, right? Where your heart rate is going up a little bit. This includes brisk walking.
Is this why you challenged me to a push-up contest right after this, or no?
I'll do a yoga contest with you instead. I'm a yogi from heart. So physical activity, right? And I think one thing that people don't really talk about a lot is stress management. I think, in my view, it is a silent cause of a lot of these cardiovascular risk factors, right?
You're the one saving these people's lives, and I don't think people know this, but you're actually an interventional stroke expert, in the sense that, maybe, a lot of neurologists and other types of doctors deal with stroke, you actually see these patients right when they're having the stroke, and we'll get into that in a little bit. But as you were saying, with the stress, is there something people can do to reduce stress besides laughing at my jokes?
Well, laughter is a great way of reducing stress. So keep telling these jokes too in your podcast, and I think that will also help people with their stress.
All right. That's good.
But yeah, there's many ways, and I think everyone has their toolbox, right? And it's not a one model fit model. It's not a one size fit model, right?
Can you combine things like golf and tequila?
I think golf I will take. Tequila I would not take, right? Because actually alcohol is a risk for a stroke.
Yeah, I know.
Yeah, so, but I think that's a joke that you want people to laugh at. But on a serious note, alcohol is a
it's
leading
just not good for you.
It's
at
not
the
good
end of
for
the day.
It's not good for you. But stress management, I think when you go into it, the simplest thing is I think identifying the stress, right? Physical activity, and some sort of a mindfulness meditation is kind of my usual approach to patients, right? And
I feel like, it's different for everybody, right? And I tell the patients, same with cancer, I tell them that to reduce their stress levels on a daily basis, like whether they pray or meditate. I think to me, that should be, we have data and studies that show that, it's not just me and you saying, hey, you know what, prayer is good for you. It's actual data that shows it decreases stress. And we know stress causes physical issues as well. Would you agree with that or no?
100%. I mean, as you know, in our autonomic system, right, you have your sympathetic and a parasympathetic. Your sympathetic tone is high, it's your fight-flight response, right? It's needed when you are in a situation. If a tiger comes in front of you, you need that fight-flight response.
I mean, did you say tiger because we're both Indian and we're both going to India
And that's my favorite
soon?
animal.
I like the tigers, so yeah.
Yeah, absolutely. And so, that fight-flight, constant, continuous fight-flight response can lead to increased heart rate, narrowing of the blood vessels, right? Your adrenal, your cortisol levels being high, right? All these impact, blood pressures, diabetes, right? So
I'm telling Chicago Bulls fans, whenever they play the Pistons, they shouldn't watch them because we really beat up on them last night with our second stringers. So
I saw that, and I was actually getting excited about the Bulls because they were doing good, but I knew eventually they were not going to make it through the...
a real team played them yesterday, and it was our bench. 3 of our starters were out, but, what are you gonna do? I mean,
I know you're a big...
I have my Pistons jersey. I'm sorry.
You're a big Detroit fan,
Oh yeah, we love Detroit. Yeah. So
but they haven't won championship in how long?
Actually, it's 2004.
I know.
So I know you have some. Apparently, there's some good basketball player played for the Bulls one day in the past.
The best in the world?
Long time ago.
In the world?
When was the last time that happened?
As the best in the world?
When was the last championship?
However, regardless of the year, people still remember that.
That's true.
And that's the only thing that people talk. Even the young generation.
Yeah, that's true.
I mean, they've never watched this guy play. I know his name is Michael Jordan.
Yeah.
And they still wear his jersey, his shoes.
I hope everyone can I think everyone knows what we're talking about.
I just wanted to make sure they knew.
No, and I think still some of the Pistons are the most hated basketball players in country.
Of course.
Ever.
Of course, the bad boys.
Mahorn and Lambier, I think, are still 2 of the most hated people. I still think they might not be able to walk in Chicago.
Yeah.
And I don't blame them. They really kind of beat him up, although, during the documentary, he did say that pushed him to get better.
Of course.
I remember he was in the weight room all winter. Now these guys, man, you touch them and it's a foul. So it's a different era of basketball, which I still don't think there should be fights, but I wish it was just a little more physical sometimes.
Yeah, it's definitely different. And I think Rodman played for Detroit, so we won championship with Rodman.
Yeah, he did. He did. Yeah. So, but anyway, getting back to strokes, I didn't. My stress level was down yesterday because we won. But in terms of prevention, I think you mentioned some really good things, and I think this goes back to the general idea of decreasing inflammation in the body by doing all these types of things. So, we talked about, preventing a stroke by doing these things. Do you think, obesity plays a role as well? I mean, now we have a lot of drugs to, we understand that as we get older, our hormones are not going to be able to necessarily always keep us thin in a sense, even if we do physical activity and eat the right foods. do you have any sort of weight management type of advice for patients if they're trying to prevent stroke or if they've had a stroke?
No, I mean, absolutely, obesity plays a role, right? I think, obesity in general can lead to a lot of medical complications, right? When I do procedures, if someone is obese, the complication rate goes up, immediately, right? These procedures are much more complex. They're much more high risk. So controlling weight is a big part of this primary prevention for stroke or any cardiovascular disease.
I mean, I was reading that the GLP-1s, they reduce cardiovascular events. So I think, that could be something else that, we could add on to maybe, reduce our risk of stroke if needed, if you see a regular doctor. I don't prescribe them. I know you don't prescribe them, but, I think everyone should see their regular doctor necessarily if they're looking for ways to reduce their risk maybe.
Yeah, and, I'm a more of a combination approach, right?
Absolutely.
I think, unfortunately, these days, people are relying on a lot of medications to do weight loss. But, at least my discussion, I'm not an expert in GLP-1, right? But my discussions with people who use it, there's a lot of muscle loss that occurs with it.
I mean, I think you have to eat properly still
100%.
and exercise for you to get the optimum benefit from a GLP-1.
100%.
But I think definitely even if hypertension, for example, there are very good studies showing that GLP-1s reduce, hypertension, I think. So, I mean, blood pressure is crazy. I had a guy last year that was coming to fix something in my house, and he told me he had blood pressure. Being a doctor, of course, I had the cuff there, and I took his blood pressure, and it was high. And he's like, "No, I feel fine." I'm like, "This has nothing to do with how you feel. You're a human being. We know these are human conditions that happen to every person alive, that they can get blood pressure even if they're thin and they eat right? I mean, some people just have high blood pressure and they need to take medications. I mean, they can look like you and I and feel fine and do everything, but if their blood pressure is too high, it can be a major problem. Is that right?
Yeah, that's correct. And I think if the problem is also you won't feel symptoms until it's really high or there is chronic effect of the blood pressure, right? So it gets ignored. It's
been there for years, and you're just ignoring it.
Exactly.
Right?
Unless that's why I mentioned it's important to have your yearly checkup with your doctors, right? So at least once a year, you're getting your blood pressure checked, right? You're getting your blood work done.
I mean, I would take it even further. I think after 40, I would say, now that I know you're not 40 yet, but, I would take it even further 25. And say, I want a cuff at my house or go to the pharmacy once a month to check. I don't know how you feel about that. Is that too much? Or I don't think it is. When I look at, okay, what's the most valuable thing? It's me being alive and my family and my health. I don't know. I think checking it once a month after 40 is probably
I don't think that's unreasonable.
Yeah,
I don't think that's unreasonable. I think it's the more primary prevention for stroke is being proactive.
Yeah. Well, that's what I think about health now in general. I've completely changed my thinking. Obviously, as an oncologist, people come to me after they have cancer. I'm like, how can I give advice for me to have less patients, to have less cancer, less chronic diseases, things of that nature. So, I want to talk about what you actually do on a day-to-day basis, because I think people don't know that. They think, if they have a stroke, nothing they can do. They go to the hospital and things like that. Obviously, we've talked about the fact that it doesn't just kill you, a stroke, but it ruins it can ruin your quality of life, and that you're, in a sense, disabled potentially for the rest of your life. And so that's why we want to prevent it at all costs, and we talk about some of those things. But, okay, let's start with just basics. What are the signs? How would someone know if they're having a stroke?
Yeah, no, and I know you asked me that question, and I know we got on off track a little bit.
Tangent, yeah.
But that's okay. I think it was an important topic to discuss about primary prevention, right? And, when we think about stroke, the definition of stroke is sudden onset of neurological deficit, right? And the common mnemonic we use, so how someone can identify that someone's having a stroke, is what's called BFAST, B-E-F-A-S-T, where B stands for sudden onset of any balance problem, dizziness, symptoms like that, right? E stands for any vision changes. So if you have sudden onset of double vision or vision loss, that's you got to think about a stroke. F stands for facial drooping, numbness, tingling, right? So if you have any of those symptoms, you got to think about a stroke. A stands for arm. So any arm unilateral usually, weakness, numbness, tingling, you got to think about a stroke. And again, these are sudden onset that occur. S stands for speech, right? Where you have any slurred speech or problem finding words or understanding words, that could be a sign of a stroke. Right? And T stands for time. Right? We always say brain, time is brain. When you have any of these symptoms of stroke, it's critical that you call 911 and get to the hospital. And that's kind of where I play a role, right? Because nowadays, when I was in a training, there's not a lot of things we can do for strokes, but the stroke treatment has evolved significantly where we have now capacity to reverse large stroke. And this is why it's so critical that you get to the hospital as soon as you can, because these are time-sensitive treatment that we can offer.
And that could, just to be clear, if you can get to the hospital, of course, immediately, this is a medical emergency, and you could potentially reverse some of the long and short-term effects of the stroke. Is that right?
Absolutely.
And I just want to be clear. I know there's different types of strokes. Are strokes from, obviously, we talk with, I talk with the hematologist about the fact that the blood, from a hematologic standpoint, provides oxygen and nutrients to the rest of our body. But from a stroke standpoint, is it just like, how does it happen? Your blood pressure gets high and then one of your arteries gets blocked? Or can you explain that part of it? Like, what's going on? Now, you've described the symptoms.
Yeah.
What is actually going on in the brain in simple terms?
Yeah, so there are two types of stroke, right? One is where you have a bleeding in the brain, where artery burst or vein burst.
Is that from high blood pressure?
That's the most common cause of bleeding type of stroke in the brain. Now, there are other causes, but most common is high blood pressure.
Okay.
Right? And that's around 15% of the strokes.
Okay.
85% time is what we call ischemic stroke, where you have actually a blockage of a blood vessel from either a plaque that has built up, a clot that's causing...
Is that similar to having a heart attack?
The
mechanism of action?
Not all mechanism of action is same as having a heart attack. But one of the etiology, one of the cause of a stroke could be similar to what happens in the heart. What we call atherosclerosis. That's basically a plaque that has built up over time. A lot of people say it's genetics, it's cholesterol. In my opinion, it's lifestyle. I think it's a lot to do with what you do every day, and as we talked earlier. But yeah, so one of the cause of a stroke is a plaque, and I think this is what makes stroke different and unique from a heart attack, right? Because 99% heart attacks are related to atherosclerosis, or this plaque building up in the arteries, where stroke is heterogenic. There are different causes of stroke that we have to kind of try to identify when someone comes to us with the stroke symptoms.
So let's go to the history a little bit. So when was it? Like, I think it's amazing. I talk about this for cancer. Even when I started doing this, there was maybe identified 100 cancers. We had 30 cancer drugs. Now we've identified over 200 different types of cancer, and there's over 300 cancer drugs. So I want to get a better idea of where we've come, and survivals are better for all types of cancer, except for a couple we barely made any progress. But for the last 50 years, let's say 50 years ago, did we know about all this stuff, or was this all discovered in the last 50 years?
50 years ago for sure. I'll tell you, history was my weakest subject in school.
To me, it's amazing, the art of observation. At some point, someone discovered that there's some sort of brain process going on that caused you to, lose function of, whether it's your extremities or, facial drooping or whatever. And I just want to understand better in the last 15 years how we understand strokes better and what we're doing to, besides preventing them, what we're doing to kind of like make things better if they're going to occur.
Yeah, no, and that's like medicine. Everything evolves. I mean, since we started in our training till now, I mean, so much has evolved, and
I'd say the most for cancer, at least, it's the most that's ever evolved.
Yeah, same thing with stroke.
Yeah,
same thing with stroke. I mean, just to give you an idea, there's a what we call large vessel occlusion stroke, right? Which means that one of the large blood vessels in the brain is blocked off. 15 years ago, we didn't have a lot of ways to reverse these.
Mm-hmm.
Now we have a level 1 evidence, the best evidence in probably entire medicine literature, where we need two to three patients to get a good outcome, where we can go in. That's kind of what I do at the hospital. You ask what I do is, let's say if you had one of the stroke symptoms, you came to the hospital.
Okay, so let's just say right now, start having some facial numbness, you notice that on me, I think you'd tell me, just go right to the hospital.
Call 911.
Hopefully you're nice enough to drive me to. No, hopefully you wouldn't call that. Man, I hope you take me over there, man. We're right here.
That's what we don't want people to do.
What?
Right? Because you have no idea what will happen from here to the hospital, while you're driving or in a car.
So you're saying if I was having a stroke right now, you shouldn't take me. That'd be the wrong thing to do.
100%.
Oh, man, I'm getting educated right now.
100%.
So you would call an ambulance, even though CDH is
Even
5 minutes
right
away.
100%.
You call an ambulance because why?
Because your treatment starts at that moment.
Okay.
Right? You got vitals, you got blood pressure.
Oh, okay, got it.
Right? And you were in a facility like CDH where I
How
work.
fast, like where you work, I'm just curious.
Yeah.
How fast, if I called right now, how fast can an ambulance get to me?
You can probably get there within 15 minutes.
An ambulance will come here
Yes,
within
yeah.
15 minutes. Okay.
And actually, the beauty of the area that we live in, by Central DuPage Hospital, Northwestern Hospital, is that we have a mobile stroke unit.
Okay.
So it's basically a moving CT scanner.
Okay.
So if you were to have a stroke here and you
not
call,
everyone has that in the United States,
not everyone
correct?
has United States.
Okay.
There's only 3 or 4 states that have actually mobile stroke units, and
Okay.
we're lucky to have one of them here.
Okay.
And what that means is if you call 911, mobile stroke units gets actually activated. So that mobile stroke unit would come here. We would be able to do immediate CAT scan in the ambulance, know whether it's a bleeding type of stroke, because the bleeding type of stroke is treated a little differently than the ischemic type of stroke, the clot where the blood vessels are blocked. So we would do a CAT scan. If there's no bleeding type of stroke, you actually can get a reversible, a clot-busting medication right into the ambulance before you even get to the hospital.
That's amazing. I mean, I'm glad both sets of parents live close by because, as we get older, as you said, there's the dementia, heart disease, cancer, and stroke, So, okay, that's pretty awesome.
Yeah,
okay.
so, thinking about
so
evolution.
what I learned from this is you don't want to drive me to the hospital, but that's
No
okay.
driving.
That's all right.
No driving.
So the mobile stroke unit comes, and you mentioned the clot busting. I don't get it. I mean, there's not a doctor in the mobile stroke unit, is that right? So, so the paramedic is prescribing the clot, is making that call, or
there is a stroke trained nurse in the stroke unit. So there's a team.
Wow.
Equipped with CAT scan, equipped with medications, and then there is a tele visit, so a virtual visit that's set up into the mobile unit.
With a doctor?
With the doctor.
So they will call you right away?
Yes.
That's amazing. Did you set that up?
No, I did not set that up, so I can't take credit for that.
I was going to say, I think that's amazing.
That is amazing.
So, it's so different than I remember during my medical school, about, when I was on the wards and stuff like that. That's amazing. Okay.
So that's evolution. That's a big evolution, right?
So within 15 minutes. And what is the time that you can give that clot? Because I know there's a time where it doesn't matter if you give a clot busting medicine. What is that time period?
So the data is evolving, but right now, as a guideline suggests, it's 4.5 hours from onset of symptoms. But that doesn't mean that you should wait 4.5 hours.
Right.
The sooner you receive the medication, the better outcomes you have.
Okay. Right. The sooner the better.
Yeah.
Okay. So you're on call 24/7 then during the week. Is that right? Like if someone's having a stroke in this area, they're going to call you.
So my role is, I do the second part of reversal of stroke, right? So, as I told you, the stroke has evolved, the treatment has evolved, right? Where now we're able to reverse the large vessel occlusion strokes. So what I do is, let's say if you got the clot busting medication and we identify that you have this big clot in one of your major blood vessels, I can go in from your groins, like do an angiogram, and remove a clot to restore blood flow into the brain, right? And this condition has significantly improved outcomes for stroke patients and has the best
and you
data.
can save their life.
And then save their lives, but more importantly, save their quality of life.
Okay.
Right? These are the patients that 80-90% of them don't make it out of the hospital. And the patients who make it out of the hospitals are disabled, dependent, wheelchair
Sure, they have
bound,
their quality of life is not what it was.
Which now we can actually, sometimes, second day, they're able to start talking, walking, going back to their baseline when we remove the clot.
Got it. Now, maybe this is a question for a neurologist or for me. A lot of patients I see are already on an aspirin, As we know, as you know, I know, but I'll explain it for the audience. Our bone marrows, all humans, we're all the same. We create 3 types of cells: a white, the red, and the platelet. The platelets, when we get cut, help us to stop from bleeding, but they're also involved in the clotting process. So they're involved in bleeding and clotting, as you know. And there's a lot of patients taking an aspirin to prevent stroke. Do you recommend that, or do you think there's any validity to that?
Not as a primary prevention.
Okay.
I think you must have some cardiovascular risk factor, or have had a heart attack or a stroke, or.
So once you've had a stroke, then you guys put people on aspirin. Is that right?
And that's a secondary, and then that brings us to the third stage of the stroke, right? So first stage was prevention. The second is when you have a stroke, how can we reverse it? Third step is how can we, once someone has a stroke, what can we do for recovery and for a secondary stroke prevention, right? And recovery is a big part of a stroke, right? Because everyone who has a stroke can potentially have some sort of a deficits. And a lot of time when people think about deficit, it's not just physical. There's mental,
I mean,
there's
I think
emotional.
of deficit as being a Chicago Bulls fan, but that's okay. I'm just kidding. But no, I know what you're saying. Definitely. I mean, I get a little depressed when I have a sprained ankle. I can't imagine having some sort of, long-term thing that, hopefully, I mean, I know with rehab and everything nowadays are doing great things too.
Yeah,
but,
absolutely.
But yeah.
And then, the prevention part is where you think about aspirin or other blood thinners, depending on the cause of the stroke. In my mind, when I think about prevention, and this is what I educate.
Once you have a stroke, you're talking about.
Or even before the stroke. But blood thinners are after the stroke usually. There's no roll-up before the stroke, unless you have some other conditions. But when I'm counseling the patients, when I see them after the stroke, and we're thinking about prevention, that formula in my mind is, it's a team approach, right? My job, which is to make sure that they're on right medications. We've done all we can to identify the cause. If they need any sort of procedures, we have done that. And their job is to really work on their lifestyles and their cardiovascular risk factors. Because I'd be lying to you, Neel, if I said that, hey, here's aspirin, he's a statin medications, and we have best chance possible of preventing your stroke. Because that's actually not true.
So, you mentioned the statin medications. That's another thing that, do you consider, like, obviously, a lot of patients are on statins nowadays, but really anyone that's had a stroke probably should be on a statin. Is that right or no?
Well, the ischemic type of stroke, yes.
Okay.
There is a good data regardless of your cholesterol. There's a benefit.
That's what I thought. A lot of people look at the cholesterol, they're like, hey, I don't need a statin. It's like, well, I mean, most people tolerate their statin okay. If they've had any sort of TIA or stroke, I feel like they should be on it, but I don't know. I'm not an expert like you.
No, I agree. Yeah. And high-dose statin is actually what's recommended.
Okay.
Yeah.
All right. Well, anything else you want to say to the general public today?
No, I think, it's important to focus on primary prevention. 80% of the strokes can be prevented with just primary prevention. And if you were to have stroke symptoms, remember the mnemonic be fast, right? Getting to the hospital.
The Pistons are be fast. Very fast. But sorry,
losing for sure.
Yeah. But we're 10-2 right now. We're 10-2 right now. Unless
they are doing good.
Unless Michael Jordan comes back and starts playing, I think we're going to be okay.
It's too early in the season.
No.
They choked last year, didn't they, in the playoffs?
Well, there was a lot of bad calls, and one of our players could have been gambling.
Talking
apparently.
like a true fan, man.
But, I don't know.
Talking like a true fan. It's a referee's fault, right?
It's a referee's fault.
It's a referee's fault.
If we lose, it's a ref's fault.
Yeah, so, I think knowing the symptoms of stroke or be fast, right?
Yeah.
BEFAST, calling 911 immediately because,
not having your friend take you to the hospital.
Not having your friend or driving.
Okay.
And I think, understanding that we can.
But what about in areas where they don't have a mobile phlebotomy?
Mobile stroke unit?
Yeah.
I mean,
mobile stroke
you
unit.
still call 911. You still, because your initial treatment starts right away. Because what happens is there's a pre-notification that occurs when you call an ambulance.
Okay.
So,
So they know automatically what to do. There's like a protocol in place specifically for stroke for every ambulance in the United States?
Yep.
Okay, I didn't know that.
So
okay.
then the hospitals are aware that, hey, there's a stroke alert coming. So all the PCs are getting, the CAT scan getting cleaned out, freed up. The stroke alert team is getting called out. So everyone is aware that there's a stroke patient coming.
Got it.
So that's a lot of benefit. That's time-saving measures, and time is brain.
Yeah.
The sooner we start treatment, the better outcome you have, the better recovery you have, and then focusing on that secondary prevention with not just thinking, hey, I'm on the right medications, but thinking about lifestyle.
Well, Dr. Pandya, I just want to thank you for what you do. I know how hard you
Appreciate
work, and that's why you got the gray here, because you can be called anytime, apparently, when you're on call for like 24/7, I think, right?
Yeah.
And that's dedication that I certainly think is worthy of just being someone that's really there for people. So I hope Northwestern knows how lucky they are to have you.
Very kind.
And thank you for joining us today.
No, I appreciate having me, and I think this is a great thing you're doing, Neel, to create a knowledge and education for general community. I think keep it up. This is much needed. I tell my kids this all the time. Even though I work hard, I sleep really well at night.
Good.
It's very rewarding work.
Oh, of course. Yeah.
Thank you.